Hey there. If you found your way here, it's probably because you or someone you love is dealing with gallstones. And you know what? It can be a really confusing and frankly painful experience. So today, we're going to break it all down, step by step, to make sense of it all. Okay, let's just dive right in. We're going to walk through the entire journey of a gallbladder attack. We'll start with that first, really scary moment of pain, figure out how doctors get a clear diagnosis, and then map out the road to living completely pain-free.
You know, we have to start by talking about the fear. When that pain hits for the first time, it is intense and it is downright scary. That anxiety you feel, it is completely and totally justified, and we're about to see exactly why.
So let's get this out of the way right now, because it's so important. The pain is severe, and it's no wonder it sends people into a panic. Why? Because it is so often mistaken for a heart attack. The intensity, the location, it can feel terrifyingly similar to a cardiac event. This is not just in your head. That feeling of alarm is real. Now, what's really interesting is how specific these symptoms are. This is not just some random stomach ache. There's a very clear pattern. The pain is almost always on that upper right side, and sometimes you'll feel this weird echo of pain in your right shoulder blade. And the trigger? Often it's that fatty or fried meal you had about an hour ago. That feeling of restlessness where you just can't find a comfortable position, that is a huge clue.
So, we've covered what the pain feels like, but why? What is actually going on inside your body that's causing this crisis? Well, it all comes down to one small pear-shaped organ.
Meet the little troublemakers, gallstones. Seriously, think of them as little pebbles or rocks that form inside your gallbladder. And as long as they just sit there minding their own business, you'd never even know they exist. But the second one of them tries to escape and gets stuck in the exit tube, boom. That's what triggers that unbelievable pain of an attack.
And this right here, this is probably the most important thing to understand, and it's why removing the gallbladder is a totally viable solution. Just think of it like this. Your liver is the factory. It makes bile 24/7. The gallbladder? It's just a little storage warehouse on the side of the road. So if the warehouse starts causing problems, you can just get rid of it. The factory keeps on running and just sends its product directly to its destination.
Okay, so you've had that awful attack, and you're pretty sure it's gallstones. How do doctors actually confirm it? This next part is all about turning that suspicion into a rock-solid diagnosis.
You know, doctors have a pretty clear playbook for this. It almost always starts with the easiest and fastest tool they have, an abdominal ultrasound. It's completely painless, and more often than not, it sees the stones clear as day. They'll also run some blood tests to look for any signs of infection or a major blockage. And only if things are still a bit murky will they move on to something called a HIDA scan, which just checks to see if the gallbladder is working properly.
Okay, everyone, listen up, because this part is incredibly important. A typical gallbladder attack is painful, but it's one thing. These symptoms, these are true 5-alarm red flags. If that pain comes with a high fever, chills, or you notice any yellowing of your skin or the whites of your eyes, that's called jaundice, the situation has become much more serious. That's not something you wait on. It means you could have a dangerous infection or a major blockage, and you need to get to an emergency room right away.
All right, so the diagnosis is in. Now what? This is the point where we pivot from figuring out the problem to solving it. This is the part of the journey where we focus on ending that pain for good. Now, this is a really key distinction to understand, the difference between silent gallstones and symptomatic ones. If a doctor finds stones by accident, say during a scan for something else, and they've never caused you any pain, the approach is usually watchful waiting. But, and this is a big but, the moment they cause that first attack, the game completely changes. Now they're a known problem, and they need a permanent solution to prevent really serious complications down the road, like pancreatitis or a severe infection. And that permanent solution is a cholecystectomy. It's just the medical term for surgically removing the gallbladder. Now, I know the word surgery can sound intense, but you should know this is one of the most common and safest operations doctors perform. And for most people, it's done laparoscopically, which just means a few tiny incisions and a way faster recovery.
So what happens if things get a little more complicated? Like, what if one of those stones makes a run for it and gets stuck in the main pipeline? Well, there's a plan for that too. It's a non-surgical procedure called an ERCP. A specialist can actually go in with a tiny, flexible scope and pluck that rogue stone out, clearing the way before the main surgery even happens.
And now for the big question, the one that probably causes the most anxiety for people. What is life actually like without a gallbladder? Let's walk through what recovery and your new normal really look like from a practical, reassuring point of view.
you might actually be surprised at just how quickly most people bounce back. I mean, we're talking about getting back to light activity within just a couple of days. The first week or two is really about adjustment, especially with your diet. Think small, low-fat meals. But by week 2, most people with desk jobs are back at it. And by week 4, you're usually cleared to get back to all your normal activities, including exercise.
And this really gets to the heart of it all. Your body is incredibly adaptable. Remember that factory? It's still working just fine. By getting rid of that problematic little warehouse, you've stopped much more serious health problems from ever happening. Now, is there an adjustment period? Yes. Some people notice some digestive changes for a little while, but your body learns, it adapts, and for most, things sort themselves out within a few months.
And this is the whole point. This is the payoff. This quote says it all. The relief from that specific awful, debilitating pain isn't just gradual, it's immediate and it's permanent. That whole cycle of pain and worrying about the next attack is finally over.
So, think about where we started with that moment of sheer, terrifying pain. And now we have a clear understanding of what causes it, how it's diagnosed, how it's fixed, and what life is like afterwards. The hope is that by understanding this whole journey, you can take that initial fear and turn it into confidence, knowing that there's a clear, safe, and effective path back to a healthy, pain-free life.